You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, Dr. Bandy. How are you?
Good. How are you doing?
Good. I have a pleasure of having you here with me on the show. And I
Glad
want
to be.
to get your perspective on a couple of things related to your professional career. Um, and we'll get to that part, but I want to give listeners a little bit of an overview of your career. You know, how did you start? What's going on? And then what are you doing now?
Yeah. Thank you for giving me this opportunity. So it's a long course. I with a medical schooling. I moved to UK. In UK, I got my MRCP from University of Warwick, Royal College of Physicians in London. Got my FRCP and did training in pulmonary medicine from a place called Papworth. And then that's in Cambridgeshire, and then moved to USA eventually. I worked and trained for a long time in Cleveland Clinic, Ohio, where I specialized in ILD and sarcoidosis. There are two diseases. And then I moved on with my career. I was before the current job, I was associate professor at University of South Florida and director of ILD and sarcoid program. I in fact established the program there, and more recently, I have joined Advent Health System, which is the largest health system in Florida, as a director of advanced lung disease, ILD, and sarcoid program. So I'm building up these two programs here now.
Very nice. So you're part of a big research program initially, right?
Yeah, I have always pursued the career in research, and I have worked in academic almost more major part of my life.
Yeah. So this is a different path than most people don't know about. And I want to talk to you a little bit about this. You know, most of my guests are usually clinicians and people that are dealing with their lives with patients every day. You're someone who's more focused on the research part of it, this, you know, especially in the first part of your career. And I want to see how did you deal with this part of, like, so to speak, I would say academic medicine or empirical medicine, not necessarily being in contact with patients all the time. It's one of the aspects of our career that is not really known, or people don't know exactly what entails, but it's the fundamental basic stepstone, I would say, for development of a career or, you know, medicine in general.
Yeah, you are right. That's interesting comment, and you are absolutely right. Uh, as far as my research is my research is concerned, I have been a clinician all throughout and pursued clinical research, not the bench research. So my research are mostly based on outcome in the patient. So I have been involved with the patient. We were taught in the medical school that there's a three corners of a person's career. One is research, one is education, and another is clinical. So you have to make a balance which three you want to take. So I tried to go with the three corners, both the three corners together. So my research I did based on the clinical in the clinical context. It was in direct contact with the patient. Rather, if I may say so, the current job I'm doing, I've moved away a little bit from academic to more of a clinical oriented work. And research, which has been my primary goal, as you said, is now it's a secondary goal. It has fallen behind. So now it's a little bit of adjustment. And I'm learning, like transitioning from academic medicine, who has pursued a career of research focus, to a more of a clinical orientation now.
I see. Yeah. What do you think the most successful idea and I would say, mindset in people that are doing what you're doing in terms of like clinical research path and,
Yeah.
academic environment? What do you think a person like you needs to think and have the mindset to be successful?
Yeah, you're right. It's a absolutely completely different mindset. It is the satisfaction, in inner satisfaction doing a research. It does not bring in a lot of wealth or money or anything. It is just the way in the career I built up my career, that doing research, knowing what is it, teaching students. So these are all part of my life, and I carried forward that. It is the, it's a type of inner feeling, like sometimes I miss it now, or essentially I feel some part I have lost, I've hollowed out when I transitioned from research to clinical, completely clinical work. So it's just inbuilt, it came with me. I never thought that I'll pursue the career. Beginning, when I started doing, I just loved doing that, and then I
Mhm.
got involved more and more into it, and dig deep into it, and it became part of me.
I see. Why did you choose this specialty? And why in particular sarcoidosis?
Okay, you mean pulmonary, why I became a pulmonary doctor?
Yeah.
So it was very strange. It was, I never wanted to become a pulmonologist, and when I was in training, I used to hate pulmonologists. I never liked any pulmonologist. It came from the mentorship in England. Like I was trying to pursue my career in cardiologist, and one pulmonologist who Dr. Hill is his name. Unfortunately, he has passed away. So he used to like me a lot. He would try to push me towards pulmonary. I was sort of not very interested. So he one day told me, "Well, I like you. Can you give me 1 year of your life to me?" I was a little surprised. He said, "1 year, you follow what I say. Then, if you don't like it, go back to your life of doing that." I said, okay, fine. That time I was young. So he said, I'm giving this letter. Go to one physician. He is the head. He was my colleague, and he is the head of University of Cambridge, Cambridge University Pulmonary Division, and work with him for a year. And you will enjoy. If you like, you stay as a pulmonologist. So I just took it, that's fine. I used to respect him a lot. I took the letter, I went to him, and then the process started. And that's how I got the exposure of how, what is pulmonary, how in depth it is, how varied it is, how interesting it is. And then I decided that I'll be a pulmonologist.
That's very interesting.
Very
Yeah,
interesting.
the power of mentorship is something that um, probably everyone has in their lives, and each one of
Yeah.
us had follow at some point in our life someone that we liked, and it was a successful doctor in that field. But I'm interested more about the subspecialty, I would say,
Oh,
for sarcoidosis, right? Because it's a disease that is not very common, and nowadays, especially in the United States, it's somehow rare, but it's a devastating diagnosis. So, what can you tell us about how do you manage this subspecialty? What have you seen in the clinical, population? And if there is any difference of the things that you've seen here in the United States compared to UK, for example?
okay, that's a good question. So again, why I became sarcoid specialist? Again, the mentorship. I learned interstitial lung disease in the Cleveland Clinic, and my mentor was the world's one of the top sarcoid specialists. He's the world's, if a top three, like he was to, everyone in the world knows him. So we used to get referral from all over the country in USA and outside as well. So
Hmm.
I worked with him nearly 6 years. Working with him, automatically sarcoid touches you. It gets rubbed on you because it will be part of you if you work with my mentor. So that's how I started my sarcoid career. There was no choice. Honestly, in the beginning, I had no choice. But again, you have to love what you are doing. Like
Mm-hmm.
I started loving interstitial lung disease and sarcoidosis. It's a unique disease, and one day he told me, I still remember the word. Look, okay, it may be we are a small community, but how many diseases there? For there's a separate specialty for one disease. You have a organ specific subspecialty, you have a subspecialty for a program, but one disease subspecialty it created because it is so varied, so diverse, so little is known about that disease. Is so thing is this, that's how I started liking it. And it is an unique, it's an unique disease in the sense like what happens in sarcoidosis is unique, and disease trajectory is so difficult and different in every individual. It's a challenging part to how to manage those patients, how to predict what will happen to them, what will be outcome to them. So it is exciting and challenging. That part I love about sarcoidosis because it's there's so much unknown into it in dealing with that.
Yeah, indeed. And have you seen any difference along the way in their, incidence in the population in different regions?
To some extent, yes, because sarcoidosis is generally considered a disease with an African American population and female. But surprisingly, maximum sarcoidosis I saw when I was in Pennsylvania. For a brief period, I worked in the rural setting in Pennsylvania, where, of course, there is most of them are Caucasian population, and they are mostly miners and farmers. It was a completely rural worker, and the amount of sarcoidosis I saw, it's astounding. I could not believe so much sarcoidosis could happen in the white population, white male population. So a lot of things we do not know yet on sarcoidosis unknown, and the
Yeah.
traditional sarcoidosis disease of this group, other group has less. If you dig deep, I think they are unreported cases
Yeah.
a lot more.
Obviously you got to a point in your career that you're now, an accomplished physician and researcher and, someone who has some kind of stature in the field. But I'm sure the along the way your success is probably based on a lot of moments that didn't necessarily go your way and you learn from them. Not necessarily failures, but stepstones to something bigger. Anything that comes to mind that didn't necessarily went well in your career?
So as I said, I love patient. I've been in touch with the patients. They taught me. Sometimes good, sometimes bad, sometimes not so good, I would say, from the patients. Sometimes it's desirable, sometimes it's not so desirable aspect of this. Yes. So thing is this. So it's a mixed bag as far the patient learning from the patients. That's where I learned most of mine is about the life trajectory or professional trajectory. Yeah, thing is this. My route has been a little bit circuitous. Like I came in this country. I never had any plan. I never wanted to do. But eventually, I'm happy. Everything turned out to be positive. Although it was a struggle going through the process, I did three training. I like first training I did in India, complete training. Then I went to the UK. I had to start fresh training. Went there. I went down the career and then got up again. As I was going up, there was a little bit of problem that's beyond me. It's all geopolitical problem. I had to leave the country. I came to US. I start again from the fresh. I go back 16 years of the career. But so it was a struggle. Uh, it uh, it impacted like academic my academic career. Like I, if it was a straight line, I would have accomplished more in my academic career. But at the end of the day, my satisfaction is every time it went down, I got up again and reached to the top again. So I'm
Yeah,
happy with that at the end.
that's a great point. Your particular case, and in also in my case, also and probably more people that came to this country from other places
Yeah,
in medicine, the struggle starts usually later in life, and we go through different ups and downs, and we are very determined to succeed. And people like
that's the big thing.
you are, someone who doesn't necessarily have any kind of tolerance for failure. So we go back up and continue to fight, and get our own way to what we want to do. And I think this is a good trait to have, and a good trait to teach many medical students, especially from United States, that things can be worse, and people don't realize when they have it good, and they have to be humble in those situations and take advantage of what life offers them. So yeah,
You're right. You're absolutely right.
I want to change gears a little bit and tell me a little bit about your new path right now. You said you moved to Orlando to start a new endeavor in a new health system.
Mhm.
What do you want to accomplish? What do you want to get out of this right now?
I love that you asked this question. So, during in the last few years, yes, I have always worked in a very tertiary referral center in the big centers where referred patients I see, and I have all these modern gadgets, modern, yes, available. I utilize them to see patients. Somehow during I mean before during my job in Tampa, I had some realization. I used to do a lot of outreach, used to back how they are managing patients, and I'm well known in the community that way for communicating with the community. And this realization came to me here. Okay, we do such great things, we take pride, pat ourselves, oh, what a great, fantastic job I'm doing. Like, and one example is multidisciplinary discussion. That was one of the gold standard. We do it, but when I sat back, I started thinking how many patients I do. 5 patients a week. So there are 20 patients. So I think I am doing some great work. How much it is reaching to the population who needs it? Maybe a
Hmm.
minuscule population. What am I doing? So my reach is very restricted. I'm living in a world where I think I'm doing great, but uh, thing is it is just giving benefit to a small people. So then I started thinking different ways, is that how to reach more in the community where the patients are and they do not come to these big centers, and how to reach them. So I took some initiatives already in Tampa, and as I said, when this Advent Health job offer came, the offer was not to build a program in a very high line quaternary center, not that, but system-wide development. So branching out to do advanced lung disease clinic in they have a, it's a huge system. They have a 36 hospitals here. Well, so do the community hospitals maybe once a month here, once a month there, to the clinic east side, west side, central part of Florida, east part of Florida. So that excited me that more or than anything else, that I will be able to reach out to a much wider population, and where I can give the specialized care which I've learned and which I have provided to a very small percentage of patients in real time, if I think will be much wider in the community. That's the real one big factor, motivating factor for me coming here and starting the process.
Yeah, it's a very good point that you're making. The fact that, sometimes we get entrapped in this like ways that we do things, right? But we don't think about the impact that we need to have in the population, in the patient population.
Absolutely.
And that's a great point to think a little bit outside of the box and kind of detach yourself and look over the whole picture. You know, how can you actually help patients with what you're doing? And what's the end point here? Like, what do you want to accomplish once you started, this new path, so to speak?
So my goal here to build it was there was nothing zero. So I started to build up a program which is again those three corners. One is clinical part, two part of that. One is of course to stay in quaternary centers like where am I now, but not to restrict myself, to spread out and impact in the community by doing outreach and satellite clinics. So it's a network of program network reaching out to the populations as much as possible deep in the community. That's the clinical aspect, building up the research. And I have a years to develop the build the educational, as I say, it's a pure clinical center to build up the education in future as well. So I've given myself maybe 3 to 5 years to see a very well accomplished program to build up. That's my goal.
Hmm. Do you think overall in the medical system right now, do we need more tertiary centers like this close to the communities, or do we need more bigger academic centers to, kind of gather the minds of a specialty?
No, the first thing you are right. We need more tertiary care centers closer to the community because, with due respect, I have seen, at least in my field, subspecialty field, there is a big gap between the services and care we provide in a large academic center and the community. That gap may have been narrowed, but still it is quite wide. And I feel sorry for those populations who cannot attend and cannot reach to the to the big centers, and they are still in the community cared for them. There's a need to look after them. That's what I feel it is necessary.
Yeah, not only in your specialty, but I think in general, even in primary care medicine, I think the biggest issue of United States is that we're so big of a country that probably 90% of the population doesn't have access to a big,
And, yeah.
health system.
Mhm.
And the distances are enormous to go from, their homes to whatever city is close by, or, bigger medical center. The other thing that I see is, and I don't know how we're gonna solve this, is it's staffing those centers. Even if you reach out to them and you build them closer to the communities, someone has to be
Yeah,
there, and we
finding.
don't have enough physicians to cover that need at this moment.
It is surprising that we talk about a rural healthcare starving cities like I know kind of like cities like Chicago, cities like even like Orlando does not have enough like physician specialist physician. By 2030 there will be severe shortage of physician in these big cities. So can you imagine if you go far little bit into the more deeper into the community and rural area, how bad will be the situation?
Yeah, yeah, that's a big issue. Obviously, I think part of the discussion needs to be, the way medical insurance, health insurance works, right? Because I think most of those type of patients that are isolated in communities that don't have enough access to medical centers are people that are they lack health insurance, they don't have enough health insurance, or they don't really care about health insurance.
Mhm.
So we need to solve that also, to be able to get them to a point of care. And especially in your specialty, I'm thinking it's, because it's more prevalent, I would say, in older type of population,
Population,
right?
yes, you're right.
You have this older patients that are hard to move and hard to reach those places. And how do you how do you attend to them? It's a question that will be there probably for a long time.
It's not only the population. Another thing, of course, the population is an issue. Another, the elderly population. Another thing we do not often overlook, particularly doing sarcoid, we realized like sarcoid has one of the highest no show in the hospital. So like they do not return or they do not report no show. So it was looked into by Penn Medicine. I was then Pennsylvania, so I was part of the discussion. And I was found it out sarcoid is mostly affects the disease of working class people and lower middle class, lower socioeconomic status for people socioeconomic status. It is hard for them losing one day's income just going to the clinic, like 4 hours drive, going to the clinic, seeing. It's a one
Yeah,
day's income loss. So
yeah,
that's another very important thing to look for. Same thing for research. So like as I said, as we talked before, research nowadays we are discussing, particularly inside started with sarcoid, that at when they come for the research, that one day the sponsor will pay them for one day's income. Otherwise it is difficult to recruit
yeah,
them.
exactly. So, Dr. Bundy, how would you advise yourself, your own self, if you would go back with what you know right now when you were younger?
That's a great question. I think that, yeah, as I grow, I learn, I became more wiser, my world broadened. Uh, Thing is this, I will tell to pursue this broad vision which I've got now, coming beyond my specialized academic center working this world. I will apply it much earlier in career of my life, which I'm doing now,
Hmm.
because I was very focused in pursuing my research and academic activity. I used to think, oh, I'm accomplished a lot. Suddenly, a few years ago, I realized no, there is another aspect that I needed to pursue, this community outreach thing. So I would rather do it much earlier in my career.
Yeah, that's very interesting. Better late than never, right?
Yes,
Yeah.
exactly.
Well, I'm glad we got to chat about this, and I think it's an issue that you know it's hard to be successful in. My podcast is looking for people like you that are not necessarily raised with a silver spoon. You know what I mean?
Right.
Go through hardships and go through ups and downs and go to change of countries and systems and political waves and I'm sure racial waves too. And they come to a point where you are now where you realize that whatever academic accomplishments you had, it has to be given back to the community. And that's a successful thing by itself. I think, many people can learn from this and maybe look back into themselves a little more as doctors and say, how can I actually help the patients close to me rather than, go back in my lab? So thank you very much for what you're doing. Thank you for your time. And how can people reach out to you? Maybe they want an advice or they want to, you know,
Yeah.
just
So
consult.
my email ID is, I can leave my email ID is first name, my first brief name, Deb dot Deb dot Bandy, Bandy, Bandy 2000 at gmail.com. So usually I'm I'm known to repair you back to get back to the people who communicates with me. So that usually community knows about me. So deb.bandy, bandy 2000 at gmail.com. I'd love to hear what other listeners say about it,
Yeah,
what we talked. It was a very
absolutely.
good discussion.
Thank you
Excellent
so much
discussion.
for being here, and wish you good luck and lots of success from now on.
Thank you very much. Thank you for inviting me and giving me the opportunity. Thank you. All the best.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.